Alright.
Woo! Coronavirus!
Alright, so guys, a new week means a new video. I'm the MDC and MDCRX, and if you follow my page here on IG, you know that this week we're talking about what you should know when filling your prescriptions. So as your friendly neighborhood pharmacy intern, it's no doubt that I fill a lot of prescriptions on a day-to-day basis, and what I found is that some of us might not know exactly what we need to know about filling prescriptions when we go to the pharmacy. So today I'm just going to go through a few things that you should know when going to the pharmacy to fill those prescriptions. So the first thing we're going to talk about is the fact that prescriptions do expire. Yes, your prescription has an expiration date. For most prescriptions, generally they last for a year. So if you get it prescribed today, it will last until next year this time. That's what, the 27th? That's for most prescriptions. Or for some prescriptions, it's even less than that. And since you're on the vein of prescriptions lasting even less than a year, let's go on to our next point. You need to fill your antibiotics ASAP. So try and fill your antibiotics as soon as you possibly can. We don't want to see you guys coming to the pharmacy 1 or 2 months after you get the prescriptions asking for the antibiotic, because then it kind of seems shaky. Because 1 or 2 things going to happen. 1, the infection probably gone and you don't need the antibiotics, or 2, the infection might get worse and this antibiotic might not be effective for you anymore. So for either of those conditions, you want to go back to your doctor for re-evaluation, see if you need them or if you need something stronger. Most of your pharmacies will not dispense that antibiotic after 1 or 2 months. Let's go on to the other thing you should know about prescriptions, and that is that your health card or your insurance card, the name on it has to match the one that's on the prescription. So don't come with little Timmy prescription and because you're Timmy's mother, oh, here's my health card. No. Little Timmy has to have a health card and we have to use little Timmy's health card for Timmy's prescription. And don't come with your father's prescription trying to use someone else's health card. Whoever's prescription it is, it has to be their health card if they're going to use a health card. Because most of the times the software won't allow us to do it, and it's actually insurance fraud. So somebody will get locked up. The next point I want to look at is that if your prescription has a refill, we normally tend to give you 1 cycle of whatever medication it is. If you're getting a month each time, we're normally just going to give you the month's worth. So if you want more, just let your pharmacy know right then and there that you wanted 2 months or you probably want 3 months. And since I was talking about insurance earlier, I know some insurance companies are covering more than 1 month now, so they might cover 2 months. Ask your pharmacy about that though, because I know they did it for the COVID period and then stop it for a bit, but they might be doing it again because, you know, a corona again. So ask your pharmacy whenever you go there. And the last point I'm going to look at today is the fact that you should not write on your prescriptions. Now, I'm not talking about little notations to say, alright, which one do I need, which one do I not want to get, you know, little marks like a little dot beside the drug that you want. Those are fine. But I don't want to see Keisha number right up on the prescription. I don't want to see your grocery list on the prescription. No, the prescription is a legal document. You're not gonna write up on your passport, oh, you need 2 pounds of rice on your passport. So please do not deface your prescription with unnecessary info. And also in certain cases it can be invalid if you write on your prescriptions, because we know some people might want to think that they can write on a drug. I know there's some cases that happened in the past where people think that you can just write on a drug and be like, oh, the doctor wrote it, and they're like, no, he didn't. So yes, please don't write on your prescriptions, guys. It's a legal document, just like your birth certificate or your passport, so treat it as such. Alright, so that was a short, little sweet and spicy video on the things that you should know about filling a prescription when you go to a pharmacy. Hope you guys liked it. If you do, just drop a little like, share it. I love when you guys do that each week. If you have any questions, comment it or just DM me straight and I'll answer them. Thank you for watching this video this week again, and I hope you guys come back again next week.